Growing up, I loved building model airplanes. Now, for those of you who don't know, building model airplanes requires a lot of detailed work and patience, and I guess that's why I became a surgeon. So I spent hours under a magnifying glass, gluing and painting the little pieces together. Now, imagine how much you have to use your 3D perception to do that, your stereopsis. Now, imagine waking up one day having lost your stereopsis, your 3D perception, and how much you depend on it. Well, this is what happened to my patient. It's a 4-year-old patient called Jamie. One day he's doing fine, and the next day he wakes up and his eyes were crossing in. He was seeing double, and he was having trouble navigating his house. Simple things became difficult, interacting with others, playing baseball. So, imagine how much you depend on your stereopsis and how you take it for granted, and what that means to anyone, let alone a 4-year-old child full of life ahead of them. So, what do? Let's talk about Botox. So I'm sure everyone has heard of botulinum toxin, Botox. Yeah, that's my favorite. Find on nature and have a few extra minutes, get Botox. But the important message is that you can actually use botulinum toxin to treat acute esotropia, and it can have lifelong positive impact on one's visual behavior and development. And using botulinum toxin for treating strabismus is actually not new. Does anyone actually know the story behind botulinum toxin? It's considered the most poisonous substance in the world. Just 1 gram of it can kill 1 million people. It works by blocking acetylcholine release at the neuromuscular junction, causing paralysis. And the Japanese actually researched it in the 1930s as a biological weapon, and then the US Army in the early 1940s, but it turns out it's not a great weapon of mass destruction. When released into the air, it quickly denatures and becomes inactive. So what do you do with the most poisonous substance in the world? Well, of course, you try to use it on humans. So in the 1940s, Dr. Sands purified it and then gave it to a pediatric ophthalmologist, Dr. Alan Scott, who actually used it first on animals and then on human volunteers to treat strabismus. And the very first approvals by the FDA for botulinum toxin were for treating strabismus and blepharospasm. And Dr. Scott at the time sold the patent to Allergan, and that was in the late 1980s, for about $9 million. And at the time, that sounded like a great deal. Well, by 2013, Allergan had already rebranded it as Botox and had made more than $2 billion worth of profit, and it's been used to treat everything and under the sun, from migraines to sweating and now depression. But the important message is that botulinum toxin's first medicinal use was for treating strabismus. It is FDA approved and has more than 30 years of use in pediatric ophthalmology. So why use it to manage acute esotropia? Because it can have lifelong positive impact on visual development, it's quick, and it's effective. So when our patient presented on a Monday, we got an MRI urgently on Tuesday to rule out any intracranial pathology, and by Thursday we had him in the OR to do a sedated procedure to inject Botox to both medial rectus muscles. It takes about 5 minutes to do the whole thing, which is a lot quicker than actually doing surgery. This is literally what I'll do. It's a little choppy in real life, it's a lot smoother. Patient's asleep, we bring the eye in abduction, there's a lid speculum, and we inject botulinum toxin with a 27 gauge needle to the medial rectus muscle, and then we repeat for the other eye. This is really quick. Within a few days, he was on his way to recovery, which if we were to follow the traditional path of incisional surgery, he would have had to come back multiple times for reevaluations, remeasurements, which are critical months for visual development. Our work on using botulinum toxin for treating acute esotropia was actually published last year in the American Journal of Ophthalmology. We evaluated patients that had presented with acute esotropia and were managed either with strabismus surgery or with injections of botulinum toxin. And what we found was that at 6 months after the treatment, 80% of patients that were managed with botulinum toxin had achieved good ocular alignment and use of their eyes together. That was actually slightly better than patients that were managed surgically, although that it did not reach statistical significance. What was significant, though, was that patients were under anesthesia for a less amount of time. It takes just a few minutes versus a full hour that it takes to do strabismus surgery. And it actually costs a lot less to treat with botulinum toxin injections. It costs about $900 to do the sedated injection versus $2,800 to do the surgical approach. So why use botulinum toxin for managing acute esotropia? Because it can be delivered early, it's quick, and it's cheaper. So when Jamie presented for follow-up a few months later, the eyes were great. His eyes were straight, he had regained his stereopsis, and he was no longer seeing double. He was back to his usual self. He was playing baseball, he was interacting with others, he was confident, which even though at 4 years of life he's too young to be building model airplanes, the stereopsis and the alignment were excellent and would have allowed him to do all the detail work one would require. So in summary, what I want you to know is that botulinum toxin can be used for managing acute esotropia. If patients present with acute esotropia to your office, they should be referred to a pediatric ophthalmologist early, and this treatment should be considered early in the disease process because it's quick, it's effective, and it's cheaper. Thank you very much.